Welcome to this session being presented by Mrs. Prudence Hamito. As we all know, like in other medical field, they do patients assessment. So this helps us in making informed decision on how the patient's condition is and how best we can provide quality care. So this is one of the most important parts of midwifery, as we should know that when we are doing patient assessment, it involves a lot of things that might require you to be very, very keen. So as we proceed, we need to know what patient assessment is. So patient assessment is a systematic process of gathering and analyzing information about patients' health status, including medical history, symptoms, and physical or mental health. So like I said previously, that when we look at or when we talk about patients assessment, it involves a lot of things. So we are saying that we are looking at the patient's medical history, we are looking at generally what the patient's health status looked like. So we look at medical history, we look at their physical, mental, even emotional issues. So this process will allow the health workers to understand the patient's condition, like I said earlier on also. It also helps in making informed decision about diagnosis, treatment, care, and ensure safety of the patient. So by doing assessment, we ensure that the patient is safe in our hands. One of the most important elements of patient's assessment is observation. So on no account are you supposed to allow the patients to walk in when you are not around. In most cases, let them walk in when you're already seated in the room. So, as we said that the most important part of patient's assessment is observation, we need to know observation plays a critical role in midwifery practice, allowing midwives to gather valuable information about the patient's physical and emotional well-being. So we shall not only look at physical and emotional well-being, we can also look at the psychological part, because just from mere seeing somebody, you can predict what they are undergoing. So we do this through careful observation. Midwives can identify changes in vital signs, behaviors, overall condition, enabling early detection of potential complications and deviation from the normal. So observation also helps the midwife to provide timely interventions, promoting positive maternal and infant outcomes, ensuring safe and supportive delivery. So let's look at a few components of patient assessment. So one of the most important components of patient assessment is clinical examination. So clinical examination involves a systematic and thorough assessment of patients' physical health. In most cases, when you talk of clinical examination, it involves basically something which is external or physical. That means you might have to touch or examine closely. So focusing on specific relevant area in midwifery care. So when you look at clinical examination in line with midwifery, as we know, as a midwife, we provide care for the mother and the newborn. That means whatever assessment we are going to do will involve the two, not only one person. So the component of clinical examination may include general inspection, palpation, auscultation, and specific assessment such as abdominal examination, breast examination, pelvic examination, and any other that might be reported in line with midwifery. So clinical examination provides objective data that complements history taking and aids in formulating of accurate diagnosis and individualized care plan. So it is very important for us to do clinical assessment, as you have seen. When you look at clinical examination, we are looking at inspection, which is part of the most important in patient assessment. That means we shall just be observing from outside. You can observe the fetal movements, you can observe physically how the mother is. Is she dehydrated? Does she look emotionally stressed? Does she look maybe unkept? All those you can just from seeing, that is inspection. Then palpation basically is when we are assessing the fetus from the womb, but through doing abdominal examination. Then on top of that, we also assess still the fetus or the fetal well-being by auscultating. And other specific examinations like breast examination is important because it helps us to know if the breast will be suitable for breastfeeding after delivery. We do pelvic examination to help us to know if the mother will be competent or the mother will be able to deliver vaginally. So the next component of patient assessment is vital sign assessment. Just like in other medical fields or areas or in other fields, you cannot talk of patient assessment without talking about vital signs. So vital signs is a crucial part of clinical examination in midwifery. It includes measuring and evaluating the patient's temperature, pulse rate, blood pressure, and respiratory rate. So we know that we are examining two people, but we can use one person to find out how the other one is also doing. So the most important vital sign that you should not forget as a midwife is assessing for blood pressure. It's very important. Very, very important. So the vital sign helps us to monitor and allow the midwife to assess the physiological stability and identify any abnormality or changes and response, promoting to any concerns or complications. So we do these vital signs not only for the mother but also for the fetus, though the one for the fetus we just focus on the heartbeat, or what we call pulse. We focus on the fetal heartbeat. So on top of vital signs, we don't only look at those four basics ones. We can also look at oxygen saturation, that is if the mother is at risk of anything or maybe admitted with any complication. That should also be part of your vital sign assessment. So part of vital sign assessment is pain assessment. In most cases, pain assessment is a component of vital sign, as midwives need to evaluate and manage pain effectively during labor, delivery, and even during postpartum. So do not always forget, even if you are not able to detect it physically, you can always ask the mothers if there is any pain. Okay, so some of the pain assessment you might acknowledge when you're doing abdominal examination, or when you're doing breast examination, or maybe when you're doing a pelvic examination. But if there's none, you can always ask the mothers if they're having any pain anywhere. The next is emotional and psychological assessment. So in addition to physical assessment, midwives also observe and assess the patient's emotional and psychological well-being. Midwives consider the patient's emotional states, coping mechanism, anxiety level, and supportive systems during examinations. So In most cases, because it might be your first time or the mother's first time to interact with one another, there could be anxiety, there could be maybe problem with coping mechanism, like coping to whatever procedures that you want to do on them. So it is important that you assess emotional and psychological uh, well-being of the mothers to make sure that whatever care you are providing, he's not scaring them off. So this helps to provide holistic care. Uh, it also makes you to offer appropriate emotional support. So sometimes you might encounter people who are really afraid of being examined. Let's say you know when we are examining mothers in the antenatal, they have to, it's either they remove all the dress or maybe they open for the abdomen to be visible. So you need to really provide privacy, and you support those people emotionally that whatever you're going to do is for the benefit and it's not painful, though it is discomforting. So, and also you need to address mental health concerns that may impact on the pregnancy journey. So that will help the mother. You always advise them to relieve their anxiety and stress. So uh, the next one is how best can we make sure that we are examining or we are doing clinical examination. How best can we do clinical examination? So one of the best ways of doing clinical examination is by making sure there is communication and consent. We have been talking about communication and consent almost in all our lectures. So effective communication is very, very essential during clinical examination process, because if you do not communicate effectively, it will mean that whatever information you pass might not be accepted by the patient or the clients that you want to assist. So you make sure you communicate effectively and give clear information to them for them to consent to whatever procedures you want to do. Midwives should establish clear and respectful communication with the patient, explaining the purpose and the procedures involved in the examination. But we don't see that most times in the hospital. The mother will come and you just ask the name without explaining the procedure. You command them to lie down. That is not effective communication. You need to explain the purpose and the procedures which are involved. What do you want to do? Why do you want to do that? Obtaining informed consent from the patient is crucial. So sometimes even if you have communicated effectively, you allow them to make informed decision or consent. They decide whether you should proceed with the procedures that you want to do or whatever you want to assess on them. So this will ensure the understanding, ensure they understand the examination process, its benefit and potential risk. If you talk about all those, they might be able to allow you to go forward with the examination. So the next is privacy and dignity. Privacy and dignity is very, very important during clinical examination. Maintaining privacy and dignity is fundamental aspects, especially in midwifery, because we know the type of people we are handling. Midwives create a safe and comfortable environment that respect the patient's privacy and ensure they feel secure during the examination. So regardless of whatever examination you're doing, so long as it is a mother or a woman, a girl, you make sure they are in a private place where it's not exposed to other people. Modesty, cultural sensitivity, and maintaining appropriate draping practice are essential to upholding the patient's dignity throughout the examination. So you make sure you're culture sensitive, and you also do other appropriate draping practices that will make the patient's dignity is maintained throughout your examination. So the last part of clinical examination is documenting your findings. So documentation, accurate and comprehensive documentation of clinical examination finding is crucial for continuity of care and effective communication among healthcare workers. It will be of no use for you to assess whatever you have assessed if you have not documented. So documentation is very important. Though we have a lot of complaints among the doctors that the midwives, the nurses, they don't usually document. Yes, you do quite a reputable job, but we are very lazy to write. So make sure you document or write whatever you have found out. Midwives document their observations, assessment, finding, and any abnormalities or concerns identified during examination. Proper documentation supports evidence-based practice. It also helps to facilitate communications and ensure high-quality care. So it's from your findings that you will document, and this will make sure that the person, or according to your finding, the person receives quality care or maybe advanced care according to their status. Thank you so much for attending this session. So in line with the patient's assessments, we shall be ending our lectures here for today. And one thing I want you to remember very well is, as a midwife, it is very, very, very important for you to always do patient's assessment, especially clinical examination on the people we are handling. So you follow all what is required of you to do clinical assessment, and make sure whatever you found out is documented. Either it is normal or not normal. Thank you.